It's a Northwest lifestyle weekend on KOMO News. Now it's time for IRG's Health Talk, tackling health issues that slow you down on and off the field.
Dr. Andrews, thanks for joining us today.
Keep these kids on the playing field and out of the operating room.
Jamie, welcome to you and your wife Karen and the Moyer Foundation.
Thanks for having me on today, Shannon.
Get the full story on causes, treatments, and more from the region's leading healthcare experts.
Dr. Gayeth, what are some common hand injuries?
The most common hand and wrist injuries I see in golfers.
Dr. Kotze, let's talk about the elbow.
Children usually get an elbow fracture.
Dr. Barrett, how long does a typical knee replacement last?
We expect 15 years.
IRG's Health Talk is brought to you by Integrated Rehabilitation Group with 34 physical and hand therapy clinics throughout the Pacific Northwest.
What are these Olympic gymnasts going through right now?
They're going through a lot of tough workouts. This is it.
Here are your hosts, Tom Hudler and Shannon O'Kelly, physical therapist and president of Integrated Rehabilitation Group.
We welcome you once again to IRG Physical and Hand Therapy's Health Talk, now on KOMO News. Tom Hutler, Shannon O'Kelly, and our first guest of the day is Dr. Eric Brand. He is from Rehabilitation Options of Issaquah, and he's talking about sports concussions today. Here's Dr. Brand with Shannon O'Kelly.
Dr. Brand, welcome. How you doing?
Terrific. Thanks for having me this morning.
Well, we're glad you're here. Hey, before we get started, tell us about your practice. You're a physical medicine physician, and a lot of people might not understand what that is and what your specialty is, training. Set that up for us.
My specialty is in physical medicine and rehabilitation, taking care of all the musculoskeletal and nervous system needs for people who are interested in non-operative management of any of their physical medicine and rehabilitation needs.
And that physical medicine rehab needs that patients have, a lot of times that kind of boils down to sports injuries. And you're an athlete yourself or participated in athletics, so you have some experience there.
That's true. I was a rower at the University of Washington, and not only am I specialized in the field of physical medicine and rehabilitation, but I'm also subspecialized with a board certification in sports medicine.
In sports medicine, and the hot topic today, particularly with contact type sports, the NFL particularly, we see a lot in the media regarding concussions, but it not only occurs in football players or professional athletes. A lot of times these sports concussions can occur in all ages. And let's set that up. Tell us what a sports concussion is.
A sports-related concussion is a type of mild traumatic brain injury that can occur either from a direct or an indirect force being transmitted to the brain and causing an injury to the brain.
And that's important that you understand, that people listening understand that it's not necessarily has to be an impact or contact to the head. Sometimes it's a torsion or a twisting or a violent rotation of the brain, and we call it a coup, counter-coup type movement. Tell us what that is.
So a coup, counter-coup injury is where the brain is floating in cerebral spinal fluid within inside the container of the skull. And say you're traveling forward on a football field and the skull is violently stopped by an opposing player. Well, the brain inside the skull keeps traveling and may hit the front of the skull, which would be the coup injury, and then bounce back and hit the other side, which would be a counter coup.
Yeah, and kind of easily described, it's almost like a whiplash type internal injury in the brain. And I think it's important that our listeners, I know we're on the radio and anatomically it's always hard to describe this, but the brain is soft tissue, a very sensitive nerve tissue that sits inside this encasement, which is your skull. And when that happens, when that soft tissue hits that skull, that's problematic.
So the brain is made up of a series of cells called neurons that can be very sensitive. So if there's an injury to these nerve cells, it interferes with the electrical signals that coordinate our bodies. However, if you injure these cells, the gradients that send these messages can be disrupted, and that can lead to diminished ability of these cells to communicate effectively. And that's part of why with a concussion, it can be viewed as an energy crisis of the brain.
I like that idea. So, I mean, when you're talking about energy, I mean, really the brain in simple terms is kind of our computer system, and it's really the body's electrical system. So those cells, those neurons you're talking about, are sending impulses and controlling our movement, our sensation, our thinking, all the stuff that we need to do.
That's true. All these things are coordinated by the brain, and when you have these ionic gradients that are disrupted, it takes a lot of energy to use little pumps and things that use glucose and other forms of energy to reset these ionic gradients. So ironically, at the same time that you need more energy to reset these ionic gradients, you have a dysregulation of the blood flow into the brain at the same time to get the nutrients in. And that's why some people refer to this as an energy crisis of the brain with concussion.
It's complicated. I mean, when you're talking about neural tissue, particularly brain tissue, it's really complicated. So basically, when you get an impact to that tissue, it kind of disrupts all the normal functions of the tissue, causing some symptoms. And those symptoms can vary. Talk about some of the symptoms that one might experience if they've got a little bit of concussion.
The most common symptom of mild traumatic brain injury is headache. However, that being said, there's any number of symptoms that can happen with a concussion. And people say a concussion is like a snowflake. No two are the same. So it's important to understand through a symptom checklist what exactly are the symptoms.
Dr. Brand, let's continue to talk about the symptoms. You mentioned headaches as the primary symptom. Briefly, what are some other symptoms?
Other symptoms involved in concussion may include sensitivity to sound, trouble with balance, reaction time, judgment, speech, sleep.
Yeah, all those things. And there's a variety of intensities of all of those. But the rule of thumb, when in doubt, sit them out.
That's absolutely true. If there's any doubt about whether or not an athlete has sustained a concussion, it's best to err on the side of caution. When in doubt, sit them out.
So we talked earlier about all the attention concussions are getting in the media. Let's demystify concussions, and let's talk about some myths that you see in your practice. What's true and what's false?
One of the myths surrounding concussion is that helmets and mouth guards can prevent concussion. Thus far, there's no evidence that a helmet or mouth guard can prevent concussion.
Let me ask you a question. You've seen those bands that the soccer players are wearing? I mean, those headbands that are supposed to decrease concussion from hitting the ball. What do you think about those?
Again, no matter what we do to protect the skull from an impact, the brain is still floating around inside of the skull, and it's very difficult to prevent that from bouncing around or hitting the edges or getting torqued with an impact.
What are some other myths you see?
It's also a myth that wearing a helmet won't put you at more risk, because it may in fact give you a false sense of security that you're protected when in fact you're not fully protected.
Like lead with your head when you tackle, which, I mean, the education and technique that they're teaching has advanced greatly. Is there any other myths you have?
Another myth about mild traumatic brain injury is that if you haven't been knocked unconscious, you haven't had a concussion.
Okay, not true.
Not true. In fact, approximately 10% of mild traumatic brain injuries involve loss of consciousness.
And that's a real indicator that there's a concussion. And if you go out and question your athlete and they don't remember, they've lost consciousness, they definitely need to be looked at.
If someone's lost consciousness, I would recommend they go to the emergency room, especially if they've had more than 30 seconds of unconsciousness. That would be one of the indications for seeking emergent medical attention.
Good point. Good point. Any other myths you have?
Another myth is that a CT scan can tell you whether or not you've had a concussion, which leaves it as a clinical diagnosis.
Wow, it's interesting because the real danger here with concussions is what we call second impact. That's why it's important when we talk about return to play that those symptoms that we talked about and you talked about, particularly the headache or sensitivity to light, those have to resolve. And when the athlete returns, they have to go through a particular protocol to get back on the field.
That's true. It's essential that every athlete be asymptomatic before return to play. They need to be medically cleared before going through the 6-stage return to play protocol.
And in the state of Washington, we have a very specific law called the Zach-Lystead law that has very specific protocol to return to play. If someone had a question regarding concussion or sports concussion, wanted to contact you, how would they reach you?
The best way to reach me is at my website, which is rehabissaquah.com. And our phone number is 425-394-1200.
Dr. Brand, thank you for your information.
Thank you very much.
Once again, our thanks to Dr. Eric Brand from Rehabilitation Options of Issaquah. If you'd like more information on this topic, as well as how to contact Dr. Eric Brand, go to rehabissaquah.com or go to irgpt.com and click on the Health Experts tab.